So thank you so much. And again, just so many thanks to Alika and Ruben and the entire organizing team. This has just been really a privilege to participate in these 2 days with all of you. And a really tough morning to follow. I was just so moved by all the presentations this morning. I'm going to shift gears a little bit and talk more about concepts around lung health. So in response to what I was hearing yesterday, I actually changed the title of my talk. So I'm going to, the cohort is now recruiting children. And I think that that's an incredibly important step. And so hopefully over the next 20 minutes, I'll be able to convince you of the importance of health in childhood and the importance of maintaining health as a way to prevent the development of disease. I'm going to speak very briefly about air pollution and why air pollution matters. I don't think I have to convince anyone in this room of that. And then just sort of talk you through the paradigms of lung health, sort of how we used to think about chronic lung disease risk, and now I think an updated paradigm. And then I'll share with you some cohorts, the last two that I've been privileged to work on. The first I'm not at all involved in, but that I think have contributed to the literature, really supporting the inclusion of children in this important work. So we've known for many decades now that air pollution impacts health. This is one example, an early study that was done that basically demonstrated that acute changes in air pollution impact health to the point where they lead to an immediate rise in mortality. And so this was the London smog event of 1952. This was winter, everyone was burning coal. And because of meteorologic conditions, the air pollution did not disperse, but sat over London. And so you can see in black and green that the air quality became poor very quickly. And what was demonstrated in this study is that shortly after the air pollution became poor, the mortality rose. And as the air pollution improved, the mortality began to reduce. And so clearly this is, an immediate linkage between air pollution exposure and health. Fast forward now many decades, and we know that air pollution accounts for over 9 million deaths every year, which is about 15% of all mortality each year. It's also important to note that air pollution has not just acute effects, but also long-term impacts. Here on the right, what you're seeing is the proportion of deaths from chronic disease. This first figure here is chronic respiratory disease, cardiovascular disease, lung cancer, cardiovascular disease that's attributable to air pollution. And what you see here is that over 50% of chronic pulmonary disease is due to air pollution exposures. So to shift gears a little bit and just talk about pulmonary disease, this is the original paradigm of risk for chronic pulmonary disease. And this is a study by Fletcher and Pito where they recruited predominantly white men from London, and they performed repeat lung function testing to develop lung function trajectories. And they made one, I think, a sort of critical assumption, and that was that everybody reached 100% maximally attainable lung function. But they also made a number of important observations. The first being that after the age of 20, people experience a natural rate of lung function decline. If you have an exposure such as smoking and are susceptible, then you may have a rapid rate of lung function decline. What I think is also important is they observed that in people who quit smoking, that rate of lung function decline would begin to approximate that of never smokers. But we know now that this is not the entire story. And in fact, this paper by Lang et al. Demonstrated that of people within these cohorts that would go on to develop COPD, over half actually did not fit into that paradigm. Over half actually had low maximally attainable lung function, meaning low lung function when they were 25 years old, with a subsequent normal rate of lung function decline. And so that really highlights the importance of obtaining peak lung health and trying to maintain peak lung health throughout the life course. And so when does lung health develop? If you look at cohort studies that have measured lung function beginning in childhood, this is one such study, the Tasmanian Health Study, which started measuring lung function in children when they were 7 and followed them longitudinally until they were 52 years of age. What you note is that on average, a lot of these trajectories are stable over time. These are Z-scores, are stable over time. But by age 52, there's a couple trajectories that are below a Z-score of 0. This is a below average group, a persistently low group, and then one that initially is low and then has a rapid accelerated decline. And in this study, when they looked at age 52 of those people who would go on to develop COPD, what they found is that if you were in that below average group, you had almost 4 times the odds for developing COPD. If you were in the persistently low group, it was 9 times the odds. And if you were in that early below average with an accelerated decline, it was 35 times the odds. And together, these 3 groups made up over 75% of all COPD cases and 100% of the moderate to severe COPD cases. And again, I just want you to recall that figure that showed those lung function trajectories just kind of plodding along over time, starting in early childhood. And so with my work, what I'm really interested in understanding is how we develop lung health. And we think of this both as what your lung function, what your lung health status is when you're born, and then how your lung health is evolving over early childhood. To the idea that we want to try to perpetuate ideal lung health for as long as possible. So does air pollution impact lung health? I think the answer is a resounding yes, and that impact starts in childhood. So this is data from the California Children's Study, where they looked at air pollution exposures that over time reduced due to policy changes that essentially reduced air pollution exposure. So here you can see this air pollution exposure decreasing over time. And what they did is they took 3 cohorts of children, one who grew up in the mid-1990s, another in the late 1990s, and another in the late 2000s. And they looked at lung function and lung function growth in childhood. And what they had identified is that the proportion of children who had abnormal lung function, regardless of how you defined it, was lower in the cohorts of children that had grown up with lower air pollution exposure. So in other words, air pollution clearly impacts lung health, and those impacts start in early childhood. A lot of the work that I do focuses on a concept of critical windows of susceptibility. Here we're thinking about pregnancy as a critical window, which if you think about it, over a 40-week period, the lungs are rapidly developing in the fetus. And so air pollution exposures experienced by the mother may impact lung development in the child. And so for this cohort, this was a Boston-based cohort where we were able to assign air pollution exposures using satellite-based models. And here what we have, just to orient you, these are distributed lag models that can show you a time-varying association or risk with asthma when the children are 8 years of age in relationship to their exposure over pregnancy. So this is our time-varying odds ratio and 95% confidence interval. And what you can see is that for mothers who had higher air pollution exposures in the middle of pregnancy, their children had a higher risk for developing asthma by 8 years of age. There's been a lot of talk in the past day and a half about mental health, and I think it's really important to understand that mental health is not only an outcome, but it's also an exposure. We can think of mental health as a non-chemical environmental exposure that independently may impact health. And so here, what we did for this study is we looked at maternal stress experienced both over pregnancy on the left and in early childhood on the right. and examined for associations with asthma risk. Here that we use the Crisis Revised questionnaire, which gives you negative life events, 0 being low risk, and this category over 5 being high risk. And you can see that for children born to mothers reporting higher stress over pregnancy, that the risk of asthma increases. And this is true not only over pregnancy, but also over early infancy as well. And again, just sort of this point that stress can be an exposure, and if we think that these exposures may operate through inflammatory pathways or oxidative stress pathways, then actually being exposed to air pollution and stress together may have a more pronounced health impact than being exposed to one alone. And so in this paper, we looked at that interaction with stress. And what we identified here on the right, again, these are the associations with air pollution, and we see in the mothers who also report high stress over pregnancy that same window appears, where in the middle of gestation, higher air pollution exposures in moms who report high stress is associated with higher risk for the development of asthma. But what I think is really important, and also I think highlights a lot of work that this group has done to address mental health, is that if you look at the mothers who are also experiencing air pollution exposure but report lower stress, that impact of air pollution is actually gone. And so perhaps we can think about ways to modify or lessen the impacts of other environmental exposures through mental health interventions. And so I was just so excited to hear about all the amazing work that's going on here, focusing on mental health within survivors. So this is the Ghana Randomized Air Pollution and Health Study. This is a longitudinal cohort that I've been really privileged to work on for quite some time now in Ghana. And what I think is really unique about this cohort is that it's actually derived from an air pollution reduction intervention. So what we did in this study initially was it was a cluster randomized controlled trial where we tried to reduce air pollution exposures that were cooking related. And that exposure reduction was successful, and it occurred over a time period that we think of as a sensitive window. And we've now longitudinally followed this cohort. Our kids are now 10 to 11 years old, and over time we're doing a number of different phenotyping measures. I'm just going to share with you very quickly a couple results from the children at age 4, and also from the moms from age 4 to age 8, or 4 to 8 years postpartum. So we, at age 4 years, start measuring lung function in our kids. And we do this using oscillometry, which is actually a lung function assessment that has recently been added to the MauiWES cohort. At age 8, we've started spirometry, but I think as many of you know, spirometry is very difficult to do, and you really can't do it in young children. So starting at age 4, we're using oscillometry, which is an effort-independent measure. This is looking at X5, which is basically showing how stretchy the lungs are. A more negative X5 is worse, a more positive X5 is better. And so here on the left, using those same distributive lag models, what we are identifying is that higher exposure in late gestation is associated with worse lung function. And this is actually a measure of small airway lung function. We heard some talk of that yesterday, and small airways are thought to be one of the origins of COPD. And so we think that this may have implications for life course lung health. Interestingly, if we look at the effect by intervention, what we see is that kids who were born to mothers in our intervention arm that had a reduction in air pollution exposure over pregnancy actually have better lung function. And this is 3 years after our intervention ended. I think also just a point that I really want to highlight is a point around multimorbidity. So we talked yesterday, there was a lot of talk on the panel about how amongst different populations we see hypertension, hyperlipidemia, we see diabetes, kidney disease, and that type of, syndromic problem oftentimes has its origins in the same exposures. They have their roots in the same processes. And we believe that air pollution is one of those things that affects multiple organ systems. And so in our cohort, we're also looking at associations with cardiovascular health. I talked before about lung function, how it tracks. Blood pressure does the same thing. Blood pressure tracks over childhood. If you have high blood pressure in childhood, you're more likely to have cardiovascular disease. In fact, there are autopsy studies of children that have died from traumatic causes that have identified that atherosclerotic plaque actually starts building up in childhood and is linked to the number of risk factors that you have. So again, thinking about health is important and really critical to think about in childhood. And so here what we're demonstrating is that higher air pollution exposure, again, in late gestation is associated with higher blood pressure in kids. Again, this is when the children are 4 years of age. Again, when we look at our intervention, what we see is that those children who were in that randomized arm with a lower air pollution exposure, that those children have lower blood pressure. Again, supporting the idea that air pollution exposure is critical for the development of both lung health and cardiovascular health in children. And I just want to leave this. This is recent work that we've been doing. We're now looking at our blood pressure data. This is in the children blood pressure data through 9 years. We do annual measurements of blood pressure. And what you see is that of all the readings, there are a significant proportion of children who are either prehypertensive or hypertensive. And again, this is by 8 to 9 years of age. Currently, the recommendation for screening blood pressure in children is, I believe it's a grade C recommendation. And also, when we look at our lung function by spirometry at age 8, we see that only 77% of our kids have normal lung function. That's over 20% of our children are already meeting some criteria for abnormal lung function at 8 years of age. This is going to be a huge problem in Ghana if these results are at all representative of other communities, other rural communities. And I also just want to say that this is a rural community in Ghana. Our children are not obese. Our children, if anything, are wasted and stunted. They're malnourished, but they do have a ton of environmental exposures. I focus mainly on windows of susceptibility for children, but I also just want to point out that pregnancy is a really critical window for the development of cardiovascular disease risk in women. So you may have heard or you may know that preeclampsia, placental abruption, that there's a number of typically placental-related abnormalities in pregnancy that are associated with subsequent increase in cardiovascular risk. We believe that part of the effect of air pollution may be through changing placental function, and so we look to understand whether our intervention, again, that reduced air pollution exposure, was associated with cardiovascular health in the moms. So this is using resting blood pressure measured annually, starting 5 years postpartum through 8 years postpartum. And what you see is that in our intervention arms, the mom actually has lower both systolic and diastolic blood pressure, even up through 8 years postpartum. So again, air pollution exposure is critically important. It's important to think about specific time points in the life course when whether it's the developing fetus or the child may be particularly susceptible. And that's why I'm so thrilled that children are now being included in the MauiWES cohort. And also, I just want to reiterate a comment that was made yesterday. I think it was Pedro that said challenges represent opportunities, and I really love that phrase. I think it's so true. And, I think that there are, and I've heard from the different groups that spoke this morning and even yesterday, that there's so many community strengths that can be built on to try to rebuild and overcome a lot of the structural aspects of how we currently have our cities and communities that really contribute to poor health. I think it's critically important that we all recognize that air pollution exposure is not random, but that communities who have been systematically marginalized are disproportionately exposed to air pollution. They live in towns and cities near major roadways with power plants, and these are all structural systems. There is not a genetic predisposition to air pollution exposure, but rather it is how we have built and sustained our communities of color. So I just want to really emphasize that, and emphasize that I think it's going to be critically important, as you already have done, to think about community resilience and how we can build and lift up communities. So thank you so much for the opportunity to speak. As Alika mentioned, I just feel so blessed to be here. My family is in Hilo on the Big Island. My family is originally from the Philippines. My family came to Hawaii to work in the sugarcane plantations. And I think, I just want to highlight that as I talk about community resilience, for me, my mother was the first person in her family to go to college. My family collectively pooled all their money to send her to college. And I now get to stand here in front of you as a physician, as a researcher, and talk to you about, what I do. So again, it's not the people. There is no genetic predisposition to being poor. It is systems, and there are resilience factors within our communities that we can build on to help lift up our people. So thank you so much.